Hello and welcome to this session of Saturn Training. Today we're going to be learning about emergency first aid for injuries with emphasis on situations you might encounter in your daily duties with the Department of Human Services. This program is being produced in cooperation with the Central Oklahoma chapter of the American Red Cross. The first aid skills we will be demonstrating are the skills taught in the Community First Aid and Safety course. As a part of this training, your office will receive this book, a Red Cross First Aid and Safety Workbook, which will give you a permanent record of today's training and serve as a resource for future information. One caution, this is an informational program. It is not designed to teach you all you need to know about these skills. To do that, you will need to take a Community First Aid and Safety course, and we highly recommend that you do that if you haven't already. Before starting, please remember to sign in so that you will receive proper credit for this training. During this program, you will learn the universal precautions you should take to avoid infection and disease transmission, the emergency procedures involved in check, call, care, first aid for soft tissue injuries such as bruises, scratches, cuts, and abrasions, how to control bleeding, first aid for burns, whether caused by heat or by chemicals, insect bites and stings, how to care for broken bones. Thank you for joining us today. We hope you enjoyed this Saturn training.
It would be nice to live in a perfect world. No stumbles, no falls, no burns, no bites, no owies at all. Might as well burst that bubble. This is the real world, and all kinds of unpleasant things happen all the time.
Are you okay? Oh my God, no, you had an accident. You just take it easy. Oh, hey, calm down. Sit. Do you have any broken bones?
No, I don't think so.
You look okay. You're gonna be okay. You're just in shock. You've had quite an injury. Is it okay if I help you? Okay, you just stay put. Do you have a car phone? Get 911, would you? Okay. Now we're gonna apply a little pressure. Oh, you've had quite a bit there. I know, it's gonna hurt, but we need to do this. Can you unbuckle your seatbelt? It'll help you relax. Do you feel like you have any broken bones? Okay. Just stay put. We're gonna get someone here right away.
They're on their way.
Okay, thank you. You have a first aid kit?
Yes, in my trunk.
Okay, go ahead and bring it, would you? Might help you relax a little bit. How you doing?
Injury is one of our nation's most important health problems. Most of us will have a significant injury at some time in our lives. In the next few minutes, 2 people will die and 170 will suffer disabling injuries. If you are the first on the scene of one of these injuries, you need to know what to do. This training will give you some, but not all, of the information you will need. First, let's deal with a question that is in the back of everyone's mind. If you come upon someone who has been injured, should you try to help them? The answer, of course, is yes, but there's always another question. Am I risking my own health? Could I catch some kind of disease from the victim? It's a natural question, but the risk is far less than most people suppose. If you do not have any cuts or sores, your skin protects you as you give first aid. However, there are some specific rules to follow when you're trying to help a victim. Avoid contact with body fluids when possible. The more serious diseases, such as hepatitis B and HIV, which causes AIDS, are transmitted through blood and other body fluids. Place barriers, such as disposable latex gloves or a clean, dry cloth, between the victim's body fluids and yourself. Wear protective clothing, again, disposable latex gloves, to cover any cuts, scrapes, and skin conditions you may have. Wash your hands with soap and water immediately after you give care. Do not eat, drink, or touch your mouth, nose, or eyes when giving first aid. Do not touch objects that may have been soiled with blood. Be prepared by having a first aid kit handy, and be sure the kit includes latex disposable gloves. Following these guidelines decreases your risk of getting or transmitting an infectious disease. Remember always to give first aid in ways that protect you and the victim from disease transmission. You can make a difference, and the worst thing you can do is nothing. So if you are on the scene of an accident or other injury, take a moment to decide how you can help. There are 3 things to do, and they fit any emergency situation. First, check the scene and the victim. Is the scene safe for you and other bystanders? What happened? How many victims are there? Can bystanders help? One other important point. If the person is conscious, ask their permission to help. If the person says no, you cannot legally do anything. But if the person says yes, your actions will be covered by the Good Samaritan law. The law says that a person rendering assistance must give the help that a reasonable person would give. It does not mean you cannot be sued, but law protects a reasonable person rendering a reasonable act. But you must ask permission first. Second, if the injury or injuries are serious, if a victim is unconscious or having trouble breathing, call 911 or your local emergency number immediately. Perhaps you can get one of the bystanders to do this, but make sure someone does, and have someone return to confirm the call has been made. Third, care for the victim. Let's look at some injuries you may encounter. Not all of them are life-threatening, but you can be of help in each case. Here's a scene every parent has encountered.
Ashley, now be careful about that hose. Watch out. Right. Yeah, oh my goodness, oh my goodness. Oh, Mom, I'll have to call you back. Ashley's falling. Okay. Oh my goodness. Oh.
These are the most common types of injuries, and for the most part are not medical emergencies. First, the bruise. This is an injury of soft tissue and blood vessels under the skin. The skin itself is not broken. At first, a bruise may appear red, then later turn dark blue or purple. The best treatment is to apply a clean cloth over the bruised area and then put an ice pack on it. Never apply ice directly to the skin. If the bruise covers a large area, or if it is extremely painful, it may be a signal of more serious damage deep in the affected tissue. In that case, you should call for medical help. Scrapes. These are caused when the outer layer of the skin is rubbed or scraped away. This is painful because underlying nerve endings are exposed. Very often dirt or other foreign matter are ground into the scrape, so it is very important that the area be cleaned and disinfected. Cuts are caused by a variety of sharp-edged objects. The skin is broken and cuts usually bleed freely. Deep cuts may bleed severely and require immediate medical help. We'll talk about how to stop bleeding in a moment. An avulsion is a cut in which a portion of skin or body tissue is partially or completely torn away. Because underlying tissues are also damaged, bleeding may be significant. You will want to call for medical help if you're faced with an avulsion. Puncture wounds are different in several ways. Since the surface wounds are usually small, they do not bleed much. However, if the puncture extends deep into the body, blood vessels or organs may be damaged. And if the object goes completely through the body, as in a foot or hand, you will have 2 wounds to contend with, an entry wound and an exit wound. Because bleeding is often slight, there is a significant risk of infection. Puncture wounds should be covered with a bandage or bandages and medical help sought. Bandage impaled wounds with objects in place. Do not attempt to remove them. Most soft tissue injuries are not medical emergencies. You can usually take care of the situation by cleaning the wound, applying some type of antiseptic solution, and a bandage. However, if the victim has trouble moving the affected area or is in severe pain, the problem may be more serious. Ask yourself how the injury happened and if there was enough force to injure internal organs. If there's any doubt, call 911. Stopping bleeding is always a priority, of course. And to give us some information on that, let's go to our Red Cross instructor.
Primary consideration in treating any wound is to stop the bleeding. Whenever you have the body fluids of another individual present, you should protect yourself by wearing latex gloves or some other barrier between you and their body fluids. To treat the wound, we place a bandage over the wound and apply direct pressure. If you do not suspect a fracture, elevate the wounded part above the heart. This slows the flow of blood. Could you hold that in place, please? Use a roller bandage and secure the bandage in place. The bandage should be applied tight enough to hold the bandage in place, but not too tight to cut off the circulation to the remaining cells in the body. Once the bandage is secured in place, observe it to make sure the blood does not seep through the original bandage. Hold that right there, please. If it does, apply another bandage right over the first one and bind it in place. Maintain the wound above the heart all the time you're working on it.
Now, another very common kind of injury.
Okay, well, the burgers are seasoned.
It's about time.
I put a little garlic on there and some seasoning salt. Did you want anything else?
Could you put a little oregano on there?
Okay. I just made some potato salad, so that should be done in a few minutes.
That'll be tasty.
Don't you think that's enough starter fluid?
Hey, you can never have enough starter fluid.
Okay, well, be careful.
Oh, gee, oh,
Oh, no! What happened? Here, let me see. Let's get that in the water right now.
The severity of a burn is determined by the temperature of whatever caused the burn, the length of time the body was exposed to it, the location on the body, the size of the burn, and the victim's age and medical condition. A burn that involves only the top layer of skin is the least severe. The skin is red and dry and the burn hurts. Deeper burns often have blisters which may weep a clear fluid. These burns are painful and the area often swells. Some burns destroy all the layers of skin and the tissue underneath. They look brown or blackish and the underlying area white. The burn may be surprisingly pain-free because nerve tissue has been destroyed. A critical burn requires immediate medical attention. There are 5 kinds of burns which would be considered critical. Burns involving breathing difficulty, burns covering more than one body part, burns to the head, neck, hands, feet, or genitals, burns to a child or an elderly person unless the burn is a very minor one, burns resulting from chemicals, explosions, or electricity. To care for a burn, follow these steps. First, stop the burning. You may have to put out flames on clothing or dry grass around the victim. Smother the flames with a blanket after you position the victim on the ground. If a blanket is not available, have the victim stop, drop, and roll until the flame is extinguished. Be careful that you don't burn yourself. Next, use water to cool the burned area. After cooling the area for several minutes, cover the burn with dry, clean dressings to help prevent infection. Bandage loosely. Don't put pressure on the burn. Don't put any kind of ointment on the burn unless it is very minor. Ointment may seal in heat and doesn't do much for pain. Don't break blisters. Keeping the skin unbroken helps prevent infection. For minor burns that aren't bad enough to need medical care, wash the area with soap and water, keep it clean, put on an antibiotic ointment, and watch for signs of infection. There is another kind of burn that you might encounter even in your office.
Who knows what's stored up there?
Ah! Oh!
Oh, my gosh! Oh!
What was that?
Let's get some water out there!
Oh! Oh! Ah! Ah!
Let's get the shirt off.
Okay. Oh! Ah! Oh, it hurts. Oh, what was that?
Poor thing, I have no idea.
Oh.
What we're dealing with here is a chemical burn. It could be common household bleach, lawn or garden sprays, and paint removers. When any of these and 1,000 other chemicals come in contact with human skin, we have a burn injury. The stronger the chemical and the longer it's in contact with the skin, the worse the burn. And as long as the chemical is on the skin, it will continue to burn. You must remove the chemical from the skin as quickly as you can, and if possible, have someone call for an ambulance. Flush the skin with large amounts of cool running water, and take care that you don't get traces of the chemical on yourself. You have one chemical burn victim, you don't need two. If possible, have the victim take off any clothes that have traces of the chemical on them. Check to make sure there is no chemical in the eyes. If there is, flush them also with cool water. And if only one eye is involved, flush from the nose outward so you don't inadvertently wash chemical into the other eye. And there is yet another category of burns all too common in offices, electrical burns.
Oh, God. Janet, would you give me some paper towels? I spilled the water down here.
Okay, but be careful because the computer's plugged in under there
Right.
somewhere.
Yeah,
Okay?
yeah.
I'm serious. Be
Okay,
careful.
all right. Ah! 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 Oh! Ah!
Are you okay? That looks really bad.
The severity of an electrical burn is determined by how long the body is in contact with the electricity, the strength of the current, the type of the current, and the path it takes through the body. First rule, never go near a person you think has been the victim of electrical shock until you are sure the power is off. In a modern office building or home, contact with electricity will usually trip a circuit breaker that turns off the power automatically, but you can't always be sure. Have someone locate the breaker box to check. Okay, power's off. An electrical burn may not look too serious on the surface, but the burn may go deep into the body. In any case, the burn is not usually the major problem. If the victim is unconscious, check breathing and pulse. Check for other injuries, such as fractures. The victim may have a spinal injury, so do not move him or her. Cover the electrical burn with a dry, sterile dressing, but do not cool the burn. Keep the person from getting chilled and check to make sure medical help is on the way. Now let's talk about insect stings or bites.
You want to use this flashlight? You may be able to see a little better.
You know, I'll bet you I'll find it without that sucker. So let me look up here real quick.
I'll just flash it for you.
Ow! Ah!
Sure.
Oh, I got bit something.
Let me see.
Oh man!
No.
Spider?
Another Oklahoman
Ah,
meets up with a
hurts.
fiddleback spider, also known as the brown recluse. This is the most dangerous of all Oklahoma's spiders and is usually found in dark, out-of-the-way places. It is easily recognized by the violin-shaped marking on its back. A person bitten by a fiddleback needs to get medical attention immediately. The poison injected by the bite can cause major damage to the skin and muscle if not treated quickly. There are two other major Oklahoma pests in the dangerous category: black widow spiders and scorpions. In both cases, there is anti-venom available to overcome their poisons. If you can safely transport the insect's body, show it to the medical care professional when arriving for treatment. Insect stings from bees and wasps are quite common, and while they can be painful, they're rarely fatal. If stung by a bee, remove the stinger. You can do this by scraping it away from the skin using your fingernail or a plastic credit card, or you can use tweezers. Try to remove the stinger without breaking the venom sac. Wash the site with soap and water and cover it to keep it clean. Applying a cold pack to the sting area will reduce swelling and pain. One other caution: watch the individual closely. Some people are allergic to insect bites and can have a severe allergic reaction, which can lead to a breathing emergency.
Glad to get that flag up. Are you
Right.
okay up there?
I'm just fine, Dorothy. If you'll just back off, I've got this under control.
Oh, gosh. Are you okay? Oh, what happened?
I don't
What
know.
does it hurt?
Oh, my shoulder.
Oh, my gosh. I'm going to move your leg. Okay?
Okay.
Let me know if it hurts.
Oh.
Do you think you broke anything?
It isn't always easy to tell. Sometimes the victim will hear or feel a bone snap, but usually, unless you're dealing with a compound fracture in which a bone actually protrudes from the wound, you won't know for sure if it's a broken bone or a sprain. Compare the opposite limb to see if you can detect anything unusual. Ask the victim if the affected hand or foot is numb or tingling. If the victim's head, neck, or back is injured, call for medical help at once and leave the person lying flat. Make sure breathing and pulse are normal. Actually, you don't need to know exactly what kind of injury it is in order to be helpful. Get the person comfortable, apply ice to minimize swelling and help reduce pain. Most important, minimize any movement of the victim. Now, let's go back to our Red Cross instructor for some information on how to immobilize a possible broken bone.
Any injury to a bone, joint, or muscle requires immobilization of the injured part. If you do not have to transport the individual, no action is necessary. However, if you do have to move the individual, the injured part should be splinted in place. Many items can be used for splinting, such as a rolled-up magazine, a newspaper, a pillow. In this case, we will use a prepared splint. We place the splint in position so that it extends beyond the joint below the injury and the joint above the injury. Would you hold that up there, please? When you bandage or when you bind the splint in place, you start near the joint above the injury and tie the splint in place. Then go to the joint below the injury and again tie the splint in place. The tie should be tight enough to hold the splint in place, but not too tight to cut off circulation to the body part. And that's how to handle a bone, joint, or muscle injury. If you don't have splinting material available, such as if this center finger were fractured, you could treat this by merely bandaging it to other body parts. This is called an anatomic splint, where no material other than wrapping material is necessary. And that's how to treat fractures and strains and sprains.
Perhaps you will never be the first person on the scene when there's an accident, but if you are, you will be able to step in and take charge. You will know what to do, and who knows, in the process, you may save a life. Thank you for taking part in today's training. Look for your copy of the American Red Cross Community First Aid and Safety Book in your office. At any time you have a moment, go over the information. Gilbert Gutrich is one of the instructors for the American Red Cross of Central Oklahoma, and I'd like to thank him for his help in demonstrating the techniques we covered today. Thanks, Gilbert.
You're welcome.
Thanks again, and have a good and safe day.